It's been more than 10 months since the COVID-19 pandemic grappled the world, including Rwanda. This has been a time that people from all walks of life have said has not been easy and has brought their work to a standstill. When we were at home during lockdown, it was a very frustrating time for me because work had stalled. I was bothered by living without work. Sitting at home was frustrating, and times were long. We are greatly affected by the coronavirus, both in our homes and at work. We no longer have capital. We weren't trading as much, and we even incurred losses. I was spending while not working, so I ran out of money. I spent all the capital. October 10th is International Mental Health Day, a day established by the United Nations to review the achievements of mental health care and address issues that remain in the field. The head of the Mental Health Department at the Rwanda Biomedical Center, Dr. Kaitenshonga Yvonne, says these unprecedented times of COVID-19 require people to show compassion. It's important for everyone to be close to one another, especially to those we know are fragile. We need to be close to them so they don't get lonely and filled with grief and fall into depression, because coming together and socializing is no longer popular like it used to be. If we are not careful, someone suffering from mental illness can commit suicide. That's why we need to reach out to these people and look out for them, and if necessary, take them to the doctors. The World Health Organization says that the COVID-19 pandemic has exacerbated mental health problems, while the UN Secretary General Antonio Guterres has called for mental health services to be improved.
It deserves our commitment. Too few people have access to quality mental health services. In low and middle income countries, more than 75% of people with mental health conditions receive no treatment at all. And overall, governments spent on average less than 2% of their health budgets on mental health. This cannot go on. We can no longer ignore the need for a massive scale-up in investment in mental health. We must act together now to make quality mental health care available for all who need it, to allow us to recover faster from the COVID-19 crisis.
A study conducted by the Rwanda Biomedical Center in 2018 found that in Rwanda, 1% of people suffer from a mental illness known as schizophrenia, 3% have epilepsy, while 12% of those aged between 14 and 65 suffer from depression, and 35% of survivors of the 1994 genocide against the Tutsi suffer from depression. According to the United Nations, around 1 billion people worldwide suffer from various mental health problems, with an estimated 3 million deaths each year from alcohol abuse. It is while every 40 seconds a person dies from suicide.